Hello, my name is Dr. Asley. I'm a board-certified fellowship-trained spine surgeon, and I'm the medical director here in Spine Treatment Center. In this segment, I'll be discussing with you the first 3 important things that you should know about your back pain. The first thing that I would like my patients to understand is that back pain is not one disease. It's the final pathway of many different conditions that present themselves as pain in the lower lumbar region. To understand that, let me just brush up on the anatomy just a little bit. I will be covering the lumbar spine anatomy in a different section in detail, but this is a model of the spine. We have 5 lumbar vertebrae stacked up on top of each other, 12 thoracic, and 7 cervical vertebrae. Each vertebrae has a complex bony anatomy, have different processes. This is a transverse process, spinous process, and another transverse process on the other side. Has a vertebral body which connects to the other vertebral body through the disc, which is the cushion between the bones, which I covered in another section. And in the back, they connect to each other through these gliding joints. We call them facet joints, which we will get to that in a different section as well. And something that's not shown in this model are the muscles. There's a very complex interaction of the muscles in the lumbar spine. Their job is to move the trunk in a 3-dimensional space in a smooth manner, which is a very complex task. There are muscles going this way, that way, crisscrossing and going toward the spine. As a matter of fact, anatomists have attempted to name these muscles of the back in layers. Therefore, that tells you how complex it is. What I'm trying to get at is that the back is a very complex structure, has many moving parts, therefore, so many things can go wrong. The discs can have a rupture in them with a herniation, the facet joints could be damaged, or any of the muscles could have tendinitis and muscle inflammation. Therefore, not everyone who has back pain is suffering from the same exact problem. Why I want that to be the first thing that I would like to teach my patients? Because lots of times I see my patients in my office and I suggest a certain treatment like physical therapy or epidural injections, and their concern is that they've talked to a friend or a coworker that suffers from back pain and they tried that treatment like epidural injection, didn't work for them. My reaction is that how we are billions of people on this planet and nobody's face is the same, that's how the back is. Nobody's back is the same. And not two people who are suffering from back pain are suffering from the same condition. Chances are there aren't. And even at that, even if you have a same condition with the same exact looking MRIs in 2 people, let's say a disc herniation at the level of L4-5, the presentation could be so different in terms of their symptoms. Now, I'm not saying that whatever I say is probably going to work. After all, you got to understand, when you're treating pain, you don't know if treatment is going to work till you do it and see what happens. That's why you start with the least invasive, non-invasive, or minimally invasive treatments, chiropractic care, physical therapy, and then you walk your way up the ladder in terms of the treatments. But of course, the surgery is the last resort, which we'll get to that. Now, what is the second important thing that I would like my patients to understand is that about 20 to 30% of what patient needs comes from us as caregivers. Is that a spine surgeon, a chiropractic care, physical therapist, acupuncturist? That's so much we can do. 70 to 80% of what an ailing back needs should come from the patient. What do I mean by that? For example, weight control. As you can see, this is a normal alignment of the spine. If you have 1 pound in your belly, to walk upright, to have a balanced gait, that 1 pound, excess 1 pound, needs to be balanced by 1 pound pull from the back muscles so you can walk upright. And guess what? It's simple physics. Both this pound and this 1 pound are pulling down on your spine and putting pressure on those cartilage and discs and ligaments. Therefore, I tell my patients, weight loss and weight control is very important because if you lose 1 pound extra weight in your belly, you actually take 2 pounds pressure off your discs. That's how important it is. 2, one of the important things actually is smoking. Nicotine is very bad for the healing tissue. Tissue heal by small vessels coming to the area and bringing nutrients to the area so the area can repair itself. Well, nicotine causes spasms in those small vessels. If you look at the anatomy of the disc, discs are actually cartilage and they don't have blood vessels. If you cut them, they look like crab meat. Therefore, they get your nutrients from surrounding tissue through seepage of nutrients. So now, these structures that are barely getting nutrients and you choke them with spasms of those small vessels, then you have no chance of healing. As a matter of fact, research has shown many times over and over that people who do smoke, who do have nicotine in their blood, and by that I mean whoever chews gum or nicotine or patch, if you have nicotine in your blood, your healing potential is less than somebody who doesn't have nicotine in their blood. That's how important it is. Therefore, that's the second thing in terms of how you take care of your back. The third thing is treatment of the back should continue, is a constant process. For example, what do I mean by that? For example, if you go to a chiropractic office and you get manipulations and care of your back, you're not done once you leave the office. If you have an appointment that you come back, let's say 2 days later, it's not like you don't have to do anything because you have an appointment in 2 days. No, you have to go home and work on your back. And it's a constant process. You have to eat right, you have to exercise right, and you have to take the pressure off your back and don't do anything that redo the injury. Therefore, care of the back is a continuous process, and you should do those at home and make sure that these therapies are continued. And it's not something that you just go have a surgery done and your back is fixed. No. After even a surgery, you have to take care of your back so you maintain your back, so you have a long-lasting results. What's the third thing that I would like my patients to understand? The third thing that I need you to understand is that, yes, we all know back pain is very prevalent. It's very common. The good thing is that actually has a good chance of actually going away. About 80% of the people who suffer back pain for the first time, they get better within 2 months of that injury. And about 90% they get better within 3 months. Therefore, the results, the outcome of back pain is pretty good. As a matter of fact, I want to tell you that about 90 to 95% of the patients, they come to see me, and I'm a surgeon, they come to see me for their back pain treatment, they end up not needing surgery. 90 to 90% of the time, I can help their back pain with what we call the non-operative care. That's chiropractic care, physical therapy, traction decompressive treatments, acupuncture, anti-inflammatory medication, maybe some light pain medications, and of course injections like epidural injections or nerve blocks. Only 5% of the patients that they come to see me, they end up needing surgery. And that's what I want my patients to understand, because I get this quite a lot. Patients come and see me and I tell them that, no, I don't think you're going to need surgery, we're going to do this. And they get a sigh of relief because they were saying that, we were so worried that we're going to end up getting surgery. And that's not true. Our job as surgeons is to avoid surgery. However, when it comes down to surgery, our job as surgeons is to tell the patient if we can help them or not, and that's all. Because the indications, 97% of the times that we do surgery is for pain. And only patient knows how much pain they're in. Only 3% of the time the surgery that we do is for spinal cord compression, which in that case is we have to do the surgery, we have to decompress the nerves in the spinal cord. Therefore, even though back pain is very common, very debilitating, painful, however, the results are good. And good chunk of the outcome depends on how patients take care of their own back. I hope you understood this segment. And the next segment, I'll be discussing with you the different pathologies of the back. Thank you.